This project hit at just the right time. There has been a movement over the last couple of years in the Black community surrounding mental health and wellness, where some of the stigma is being broken down. It's okay to seek help. People are being more vocal. They find community and family as they're going through similar situations.
I knew going into this, it was extremely important to cover both mental health and mental illness, but to ensure that we had people of color represented throughout. And so with our health equity initiative, it was really nice to have that so explicitly said, like, this is our focus. We have to make sure that we're empowering different communities of color here in LA County.
One of the photos that leads the story, Bobby was taking a breath, and there was probably like 100 Black men in the room. This photo is different than we usually see Black men. We normally don't associate Black men with like yoga and like peacefulness, deep in thought, and self-care. I wanted to approach this in a way that was uplifting, while also telling the story of some of the trauma that he's going through and showing how he has built his life and made intentional choices for his family and also for his community.
I was really interested in the nuance of stigma and how it looks in different racial and ethnic communities. And I think that's especially important here in LA County when, everyone is here, and we want to make sure that everyone is represented in our coverage, but not in a way that's like patronizing, condescending. I just felt like, let's go deeper than like stigma.
After the Atlanta area shooting, I tried to have a conversation with my dad about mental health. And we sometimes speak in English and Vietnamese in our household, but when we tried to talk about this topic, we found that we really struggled to find the right words in Vietnamese to talk about this. And so that's what inspired me to publish this survey. So the story was about a group of Japanese mothers who are in this Japanese language support group about mental health because they are currently caring for children who have mental illness. And a lot of these mothers, they're first generation. And so navigating this new mental health system was really difficult. But when they come together in this safe space in a language that they're familiar with, and not just the language, but also like a culture that they're familiar with, where there are things that don't need to be said and are immediately understood, it just creates this warm space for them to share their experiences and find resources and to help each other navigate the mental health system.
How do you not just identify the problem and talk about it, but what are people outside of this sphere doing to find the solution? How can we say, well, these people are doing this, why aren't we doing that? Or being able to ask those, I think, questions outside of who, what, when, where, and why. I think that it's interesting that there's a university in Mexico that is pushing to have that integrative approach to medicine, because it's something that Grace is also pushing for in the US. We should be able to help the whole of the patient and work together, a holistic doctor with whether it's a practitioner or some other kind of doctor. The university is now in its 5 years, I believe, of having graduated students that are also in now the medical field working side by side with doctors. This article also just kind of bared that question. If Mexico is pushing for this integrative work between these two kinds of medical approaches, why can't the US also accept an integrative form of health?
It's just really cool to me that these 3 journalists worked their tails off for the year to do these incredible stories that they otherwise wouldn't have had time to really sit with and build that trust and report it.
I wanted to make sure that I told the story in a way that really got at the core of the issue. I feel like there's a balance. Like, you do need to tell the story, but then also you need to back that up with like the stats and all that stuff. But there's a way to interweave all of that so it comes across in a way that is uplifting and it's not depressing.
It was a nice change to have more time to think out the story, to kind of unravel different threads that came about on the research. I think that it was a good change of pace. I think the utility work is really important, but so different from trying to really figure out the pulse of an issue and the people that are affected by it.
In doing this story, there was a point where I thought I had an idea of what the data and what the story should show, but after speaking with the mothers and them telling me their experience, I realized, what I initially thought should not be the story at all. I think one of the biggest takeaways I learned from doing this piece was to let the source be the guide to your story.